Combination therapy is when we use one or more procedures to have an excellent outcome. Studies have shown, even more so recently, even with PDO threading, that when we use combination therapy prior to placing PDO threads, the results last longer and the outcomes are also better because the skin is healthier. The duration of combination therapy depends on the procedures you should choose to proceed with. Such procedures for combination therapy include PDO threading with ultherapy. We usually do ultherapy prior to PDO threading. We call ultherapy the Spanx and PDO threading the pantyhose. So for example, if you were going out at night and you had a dress on and you wanted to have a very smooth and sleek line, you wouldn't wear just Spanx, you wear pantyhose and Spanx. So with the face, we can actually create a non-surgical lift by using ultherapy. And then for those fine lines as well as for that lax skin, we use PDO threads as well. It's important to note that before proceeding with any of these procedures, we usually recommend microneedling with self-neutralizing peels prior to these microneedling series because the skin needs to be preconditioned for the best outcome. You can also combine filler with PDO threads and ultherapy because we all lose volume every day. In our 20s, we start losing up to a teaspoon of volume per year, and as we age, that bone structure under our cheekbones demineralizes as well as we lose volume. So combination therapy, no matter what, whether you have surgery or you don't, it's necessary for an excellent outcome because we use filler to contour the face and to have an option for that volume that we lose every year starting in our 20s. There's several options for combination therapy. So by definition, combining is doing one or more procedures together. Combination therapy could be using two peels, but the best combination therapy is when we hit each layer of the skin. If you go back to our videos from when I first started here, I go through different procedures and how they work on the skin. You'll notice that each of these procedures has to go through the epidermis. The epidermis is the upper layer of the skin, and that is where microneedling and self-neutralizing peels begin. At our practice, we also have our mid-level providers, our PAs, nurse practitioners, go deeper in the dermis with microneedling, so you're hitting all through those layers. There are other procedures you can do in combination therapy as well. Ideally, you could take anything off our menu and combine it together for a good outcome because they do mesh so nicely together. Combination therapy is for anyone, quite honestly, anyone that's looking to get an excellent outcome. Because by providing one or more service, you're only going to get a synergistic effect.